practicing anesthesiologist who is dedicated to improving the business intelligence of all healthcare providers. When he's non-clinical, he serves as a consultant and educator, helping practices survive and thrive. He's completed the medical school at the University of Kansas School of Medicine and anesthesia residence and fellowship in cardiovascular anesthesia at Vanderbilt University. He was always interested in the business side of the healthcare and medical practices and has spent several years studying those fields. He earned an MBA after he realized that he was not adequately prepared to operate a business. He shares his knowledge via writing, teaching, speaking, and his podcasts, The Financially Intelligent Physician with David Norris, which is available not only on Apple Podcasts, but also Google Play, Spotify, and Pandora. His first book, which is The Financially Intelligent Physician, What They Didn't Teach You in Medical School, was published in 2016. And his second book, Great Care, Every Patient, A Physician's Guide to Process Improvement, was released in July 2020. Please join with me in welcoming Dr. David Norris, presenting Team Burnout and Symptoms and Treatments, and following up on the implementing change talk also. Thank you, Dr. Norris.
Well, thank you very much, Susan. It's great to be back. Let me share that there. There we go. All right. You can see my slides, right, Susan? Perfect. All righty. Well, let's go ahead and get started. Today, this first talk is going to be a little bit about burnout. And there's things I've learned about burnout over the years in my own life, personally, professionally, as well as working with others. And now, burnout is becoming a more of a problem, and I think it's something that we're all beginning to talk about. Recently, Deloitte did a study of 1,000 respondents, and they said about 77% of their respondents experience burnout at some point in their current job, and 91% said that it was the unmanageable stress or frustration that would impact the quality of their work, and 30% said burnout negatively impacted their personal relationships. So they were bringing that stuff from home, from work, and bringing it home. Even those who were very passionate about their jobs still felt stressed at work, according to the survey, with 64% saying they were frequently stressed at work. And I think I see this a lot when I work with physicians, nurses, other healthcare providers. They're feeling the same thing. They may love their job or they may love what they're doing, but they still feel the pressure and the stress. The same survey found that nearly 70% of professionals felt that their employers weren't really doing enough to prevent or alleviate burnout. I have my own thoughts on that I'll share later. And then 25% said that they didn't use all their vacation on a timely basis, probably due to the fact that they felt they had so much to do that if they leave and come back, they just have more work that's piled on, and it just is a never-ending cycle. And then many felt that there was not enough recognition or support from their leadership in their organizations. So, what are the top causes of burnout? According to that survey, job expectations that are unclear, working too many hours, workplaces, dynamics that are dysfunctional in nature, social support that's lacking, never taking a vacation. They feel as if they have a lack of control over their work or work area or their work product. And there's a lack of workplace communication. And I think that the last two are real important. As we face, particularly with professionals who kind of do what we do every day. And really all of these, I think, boil down to poor leadership at the top, but I'm not going to get on that soapbox today. So organizations can get burned out as well. And if you're in an organization and, you're feeling burned out, you might not be the only one, because some signs of organizational burnout is the team's more aggressive towards each other. They begin to fight more with each other. You got more people are using sick days just because they don't want to come in and deal with everybody else or the team. There's a lack of vision for the future. They feel like there's a sense amongst the team like this is never going to get better. The status quo is what it is, and there's too much inertia to affect change and improve things. And people become inflexible and they don't want to change. And they don't want to change processes, or they don't want to change procedures. The group's not as functioning as well as it used to. Maybe you're firing on all cylinders, and now it doesn't feel like that. And then there's an isolation. It becomes kind of an us versus them. You may have these little factions that occur within the organization or within the groups. And, I see this in healthcare. It's like, oh, it's the OR, or it's anesthesia, or it's internal medicine, or cardiology didn't do that, or it's the unit team, and they all begin to kind of bicker rather than coming together and trying to do what's best for the patient. And when you begin to see signs like that, you may be facing organizational burnout. Now, why is burnout important? Because when you're burned out, you can't lead. Trying to lead when you yourself are experiencing burnout is like pouring gasoline on the flames. You hurt not only yourself, you're going to hurt those you work and lead with, and then you can also hurt your organization and the patients. So why can't we lead when we burned out? Well, because we are social creatures and we pick up social cues. So if you're working with a team, or you're a team leader, or you're a member of the team, your teammates are going to pick up on your stress. They're going to pick up on your fatigue. And it's going to affect their morale, performance, and quality. And, you got to lead not only others, but first you really need to lead yourself. And the problem with burnout is it's a slow process, and its symptoms are visible if you know what to look for. And if you catch it early enough, you can kind of try and prevent it. But burnout can be very slow and insidious, if you will. So I'm going to go over some symptoms. And, these by themselves are not indicative of burnout, but as they pile on top of each other, one on the other, they can become more of a constellation of burnout will begin to reveal itself for you. So the first symptom is you just go through the motions, okay? You don't really enjoy what you do at work, and you just kind of show up to collect the paycheck, and or you may quickly forget the patient's name, their complaints, problem lists, or other reasons why they're there to see you. You just kind of putting one foot in front of the other just to go through the motions. Symptom number 2 would be the engagement interaction of your team is low, particularly with you. If you feel that others are not engaging with you, it could be that the staff avoids you, or they don't engage with you like they used to. It's probably not them, but you, if it's happening with more than one individual. If your nurses don't really want to come talk to you as a physician, or they don't bring you the problems, or people are afraid to approach, the problem might be more you than them. And that's pretty good clue as to you may be facing some burnout. A touch of grumpiness, aloofness, or simple apathy that you've displayed and that they've picked up on over time. They'll just say, okay, he's grumpy or aloof, and we don't want to mess with it because we don't want to catch it, if you will. And you can, when you begin to feel others behave differently around you, the thing to do is ask why, and then really focus on yourself and try and figure out why that is, and are you responsible for it? So the third symptom that you might want to think about is others, or you yourself, you're growing more concerned about protecting your space rather than growing it. And this comes from a fixed or negative mindset. And I think that's real important. A key concept when we're talking about burnout is that mindset's real important. Okay. If you're here a year ago, you taught me to talk about mindset and negotiation, but it's also important for other aspects of our life. And so our mindset is the way we think or feel about a person, place, or event. And the reason why that's important is because the way we think and feel, that determines our actions and behaviors. All right. So and it doesn't matter what it is, every action we have has a preceding thought or emotion. And if we have what we call a fixed mindset, a negative mindset that says, things aren't going to get any better. The world's fixed, the pie's fixed, the ability's fixed. This organization is as good as it's going to get. If you have that fixed mindset, you're going to get kind of stuck in that rut. And I do think that is a symptom or a condition that predisposes you to burnout. Whereas if you have a growth mindset, and a growth mindset says everything in life can get better. I can improve myself. I can improve the organization. There might be better ways to do this. I just need to look at the problem differently. If you walk into it like that, I think that actually is a nice preventative thing that will prevent burnout for you. But the good news is you can work on changing your mindset. The way you think and feel, you can change that about your person at work, the place you work, or the organization. That is more of it's a choice that you actually have to make. Most of the time, folks who get burned out, they kind of accept, they make that choice, and then they don't really fight it, readdress it, and it just kind of lingers and smolders. Whereas with the positive or more growth mindset, it actually takes a little bit of effort for you to say, no, I recognize some of these negative emotions. I really need to figure out where they're coming from, why they're there, and then how I can correct that. So the fourth symptom is you just hope to make it through the day. If you show up at work and you're like, oh, I just hope I make it through the day. Just hopefully this day will end soon. Now, this is similar to going through the motions, but this has a touch of dread, fear, and anxiety. And this is a little more severe of a symptom, because once you begin to add in those powerful negative emotions to the mix, it can really amplify what you're feeling in a negative way. And it can really amplify your feelings and your progression to burnout. So if you just it's different, like I said, different from going through the motions where you just put one foot in front of the other. This one is, man, I hope something bad doesn't happen. I hope I don't have to deal with so-and-so. Or you get anxious. Maybe you may even have physical manifestations of that anxiety. That's a far worse symptom, and something you really need to take some time and address. Symptom number 5, you've lost a vision for your work. When it becomes hard for you to remember why you dedicated your life to taking care of others, I would argue you've kind of lost your vision. And then from there, it can become an easy downward spiral towards despair, depression, and burnout. So if you have a hard time when you think about it, I used to know really why I enjoyed this job and why I went into it. But now it's harder for me to vocalize that. If that's you, you might have lost the vision, and you really need to work on rediscovering that. The 6th symptom is you fake enjoyment and work, or enjoy at work. Now that's, you do that all the time. Now there's always those patients or those colleagues that just seem to suck the joy and excitement out of your day. That's different. This is you fake it all day long, rather than, I'm just going to get through this surgery with this particular surgeon. I don't really care for him, but I can get through it. That's different than if it goes all day long. Because if it's just a colleague or a particular patient or patient type that mine are the folks that just talk and they never answer the question I ask, but I hear everything else. They kind of suck the joy out. But that's just me, and I know that, and that's a brief momentary event. But you should rebound from that pretty quickly. As soon as you get out of that situation, you get out of that operating room with that surgeon or whatever, you should rebound if you're not burned out. Now, the 7th symptom is your communication response is slow, if it even occurs. So as we get burned out, communication becomes harder and harder. And we begin to shut down because we just want to be left alone, and we don't want to be bothered by anything. And when we're burned out, we tend to answer our emails a little more slowly than before, if at all. We answer pages, but probably not as promptly because we're just tired of being bothered. Sometimes you might even avoid telling the full truth because if you do, it's going to involve a much longer discussion, and you just don't want to deal with it. So your communication and the quality of your communication declines as we become more burned out. The eighth symptom is we tend to focus on our failures, right? And we actually magnify or our failures than what they really are. What we need to do is we need to accept a reasonable metric of success and failure. And we got to realize that success isn't always binary. Okay, it's not yes or no. There are gray areas or shades of success and failure. And when we're burned out, we tend to magnify those failures. The question you need to ask yourself is, if you're being really hard on yourself, it's if I had more energy, if I had more livelihood in me, if you will, would I view this shortcoming any differently? Because burnout can contribute to that downward spiral of our self-image, and it becomes kind of this feedback loop in a negative fashion, and it just reinforces, I failed, I'm getting burned out, this is horrible, and it just begins to feed on itself as you tumble down, if you will. It becomes a negative loop that is feeded. So it is an insidious problem, and remember, it doesn't happen all at once. It's nice and slow and insidious at times, and if ignored, when the symptoms grow worse, it can actually do a lot of damage. So one thing you would do is ask yourself, how many of these symptoms do I have, or do others have that I work with? And if you have more than a few of them, then I would suggest you get help. Begin talking with others about your feelings and your symptoms, and maybe what you can do to rectify the situation. Now, Robert Coles wrote a book called The Call of Service, and he discusses a progressive 5 steps or progressions towards burnout and depression. Those 5 steps are weariness, cynicism, anger and bitterness, despair, and then depression and burnout. And each stage has its own identifiable traits that can be helpful in discovering if you or a colleague is kind of headed down that path of burnout. And we're going to go through what these traits of each of these stages are. So the first one is weariness. Now, Merriam and Webster defines weary as one being exhausted in strength, endurance, vigor, and freshness. It means you're completely used up. And if you're feeling that way, like you have no energy for anything in life, you're going to, if your hobbies aren't really, you don't get jazzed about anymore, going and seeing family or spending time with friends, if you don't have enough energy and strength for that, you're going to fit that definition of weariness. Weariness goes beyond just feeling. There's a difference between working really hard and you're tired after being up for 24 hours versus just a general lack of physical energy that you never get back after appropriate rest, what would be a normal night's rest. Okay. It involves that lack of a mental, emotional, and spiritual energy. And you typically feel empty of vigor and strength, and physical fatigue from those days and nights, that's very different from what we're talking about in emotional and mental fatigue. So questions you would ask to determine whether or not you or a colleague is in this first stage of burnout is, do I enjoy my work? Do I look forward to the day's work? Am I tired before I even set foot out the door to go to the hospital? Do I ever really feel rested or restored? And am I happier away from patients than I am helping them? Now, and if you answer yes to a couple of these, it might be a good indication that you're in the weariness stage. Now, the second stage is cynicism. Now, cynicism, if weariness continues for too long, the mental and emotional fatigue that can lead to cynicism. And again, it goes back to a fixed mindset that holds that things won't get better, things won't improve. And remember, like I said, our mindset dictates our actions. And if we don't think things are going to get better, we're likely not going to look for ways to make them better. Our mindset is a choice that we make about how we think and feel about things. And yet it can also be a choice that we elect not to make and not to allow circumstances to push us to a fixed mindset. So some questions you might ask yourself or colleagues in the cynicism stage would be, what are the problems I see, and what really makes them a problem for me or for the organization? Ask yourself, what is my mindset? What am I really thinking and feeling about this person, place, or event, or organization? And is it fixed? Is it more of a growth mindset? If I believe things won't get better, why won't things get better? Sometimes that question alone can help prime the pump and hopefully kind of help you get out of a fixed mindset as you begin to think about, well, it actually could get better. And if we do this and this, and maybe I could take the lead on that. And what can I do to make things better is another great one. And then how can things improve? What's necessary and required? And it really gets you thinking in a more positive way. And it can be, by working on those exercises, can work towards a more growth mindset and hopefully begin to move you out of the cynicism and out of the road towards burnout. So the next one, the third stage, is anger and bitterness. Now, if cynicism continues unchecked, anger will slowly creep in because deep down, you shouldn't be feeling the way you do. And then you become angry at others, the environment, and obscure entities, and you look for somebody else to put blame on and somebody else to put some fault on for your weariness, fatigue, and happiness. And that then turns into anger because you begin to attribute that someone else's or something else is making you feel this way. And then that anger then grows into bitterness. And again, that comes from the fixed mindset of cynicism, which can be empowered and dramatically reinforced with bitterness, and making that emotional emptiness these folks feel even greater. So some questions to ask when you're about anger and bitterness is, why do they feel anger, and what are the reasons? And just write them out. It doesn't matter what they are, just get them on paper. Then you can begin to discuss them. And ask yourself, do I feel anger to any person? Well, why is that? Do I feel anger to any entity, organization? Well, why do I feel that way? Or why do they feel that way? And am I unable to forgive for wrongs that I think have been done to me? And I think that's real important, because if you can't get to the point where you can't forgive, you're going to have a hard time recovering from that, because you're going to get stuck in a rut of anger and bitterness. And people owe you things, and they're responsible for this, and they need to be own up for it, and they need to pay for it or whatever. And then you just kind of get stuck in that rut of bitterness. And once you get stuck in that rut, it's an easy downhill slide further down into depression and burnout. So the next phase is despair. And if that bitterness continues, despair occurs. You're going to feel like it doesn't matter what I do; things aren't going to get better. So what's the point of doing anything new or trying to make things better if I can't change it? Again, that comes from that fixed mindset. So it really begins with how you think and feel. That's really your mental health, in a way, is really what's going to keep you from becoming burned out, and being cognizant of that and working on that on a daily basis. You feel like you're not making any progress in any direction in your life, and then you begin to kind of give up on other things outside of work. You may give up on home life. You may give up on hobbies. You may just give up all the way around when you're in this stage of despair. So questions to ask is all lost? I mean, is it really a lost cause? Is that the way you really feel, or they feel? Do you feel that there's hope for tomorrow? And, can I improve myself, and can I improve the situation? And you got to be real honest with yourself, and, talk these over with a good friend, colleague, someone you trust, a spouse, somebody who you can really confide in when you're trying to work through these questions. Or if you're working with a colleague, these would be questions you might ask yourself of them before you approach them, and then eventually ask them these questions. Then the final one is depression and burnout. So depression or despair, when allowed to continue, leads to burnout. And it's that general sense of hopelessness, and the fatigue and the tiredness and the sadness become unyielding and always there. It never goes away. And that feedback loop has become created, and a downward spiral progresses even further. And questions to ask in this stage are you experiencing any thoughts of suicide? Are you using drugs or alcohol to help cope or manage your mood? If you begin to see that a loved one or a colleague's beginning to use, they've exhibited other stages or symptoms, and now they're beginning to maybe drink a little more, or they're using, or you hear of those things, this is when they really need help. Do you feel that you're more irritable now? And have your eating and sleeping habits changed? Or do you lose your temper? Those are some great questions to ask, if you, unfortunately, hopefully never enter, but if you see a loved one or colleague maybe enter the depression and burnout stage, are we seeing those symptoms in them? And then once we've identified that, then we know we need to help, at least try and intervene. Now, burnout, it seems to be growing in healthcare providers in every specialty and in every sector. And my question is, I don't really know if we're better at detecting it and better at discussing it. I don't know if the younger generation of physicians are less, they don't have that, there's that miracle worker reverie, which says, folks who are in highly specialized areas like attorneys, doctors, physicians, or people who have, special knowledge, they can never be wrong. And when they do become wrong, they have a hard time accepting that, and then it can set off a downward spiral. I don't think the younger generation necessarily buys into that. And I don't think they also buy into the fact that it's just part of the job to work as many hours and make as many sacrifices as previous generations did. Now, one of my passions is flying. And there are many lessons that I've taken from my pilot training and I've applied to medical care and anesthesia, from checkout, checklists, and prepping and making certain, the anesthesia machine's ready versus same checklist I do before I take off of my plane, But the other day I was watching a National Transportation Safety Bureau, FAA thing on, situational awareness and keeping up on your skills. And they talked about this pilot who really didn't have a lot of hours. He was flying in the clouds. And you could kind of tell in his voice things weren't quite right. And so ATC noticed that he was having some erratic path, and they asked him if he needed help. And he kind of, no, I'm good. I just need time to figure things out. Well, he's the one at the controls of the airplane. ATC, if you listen to the tapes, he kept saying, 875 Alpha, are you okay? Hey, you want to take a turn to the right? It looks like skies are clear over there. Maybe, just give up where your destination is, where there are clouds, and, just head back home. And he's like, I got it. I can make it. And you can hear ATC again and again. Hey, buddy, are you okay? Eventually, the guy's blip on the radar screen disappeared because he unfortunately crashed into the ground and he perished. So when a pilot crashes into the ground, there's not a lot air traffic can do to prevent it. They can see it, they can try and help, but it's ultimately the pilot who has to take ownership of that and take corrective action. It's the pilot who has to fly the plane. And I think burnout's a lot of the same way. When we see burnout in colleagues, when we see burnout maybe in ourselves, it's really us who, the person who's experienced it, who really has got to take control of that situation and rectify it. We can try and intervene all we can, but much like ATC, there's not a lot we can do because we're not at the controls. Now, so when I was training as a pilot, I learned to recover from what we call unusual attitudes in an airplane. It's either a very nose high attitude or a nose low attitude. You're not wings level, so you're climbing really fast, you're losing airspeed, you're at risk for a stall, or you're crazily driving towards the ground. The thing about an unusual attitude is you got to recognize it and you got to correct it immediately. Otherwise, you're going to lose control of the airplane as you stall, or you'll go smashing into the ground from a nose low attitude. And I think that's really important when we talk about burnout, is that the word attitudes used both in burnout and in flying with unusual attitudes. They both, if not recognized and tried to rectify immediately and properly, can lead to devastating consequences. And as we're seeing, physician suicides on the rise. And I think it all starts with that attitude. Remember, attitude comes from mindset, and mindset's the way we think and feel. So the most dangerous attitude when we fly is a nose low attitude. It's where you're racing to the ground without the intent to land in an uncontrolled manner. And if not corrected, you're going to wind up as a smoldering hole in the ground. And the key to saving your life in that situation is recognizing your attitude. Now, bear with me for a minute, so this is, was you're racing to the ground, you're spiraling left or right, and if you don't recognize that particular situation in that picture, you'll wind up hurting yourself and whoever else might be on the ground if you hit them. So when we recover in an aircraft, our goal is to get straight level flight and then work on returning the plane to where it was. And so, and I think with burnout, that's the same thing. Burnout is, we want to do what we can to get to straight and level flight in terms of your mental status. And then once we get it corrected, then we can slowly bring you back up to where you were before. It's possible, but we don't want to, the goal is not just to get right back where we were before. The first thing is to stop the descent. Okay. And so once we recognize our predicament in a nose low attitude, we're going to pull back our throttle. We're going to get our wings level, and we're going to pull the nose up. So when we pull the throttle back, because we want to stop any thrusters that helps us race towards the ground, we want to get our wings level so that when we pull our nose up, the airplane is made to take the maximum amount of stress when we pull the nose up when they're level, okay, when the wings are straight level with the ground. If you're at an angle and a bank angle, you can actually, rip a wing off if you're too steep. So we want to slow it down. We want to get things level so that we can take that stress. And then we want to pull our nose up to stop the descent. So recovery from burnout is once we've recognized that we're tired and exhausted and burned out. We want to pull back on our throttle. And to do that, that might be taking self-care time, family time, golf, hobbies, whatever it is. You just want to slow things down. And maybe you don't see as many consults or see as many patients for a while. Then we want to get wings level. To do that, we want to evaluate and cut back obligations and duties. Maybe we're overextended. Maybe as part of that, we need to reduce some of our other obligations so that we can take that stress as we bring that nose up, if that makes sense. And then I've noticed a lot of the times our duties are self-imposed because we seem to have a save the world attitude in healthcare. And sometimes in order to do that, to get your wings level, you got to say no. You got to say no to some things. No, I can't make that meeting. No, I'm not going to do that. Just to kind of reduce that stress on yourself as part of getting your wings level. And then you want to pull your head up. All right. You want to lift your gaze. You don't have to look up high. You just want to get focused on the horizon and get your bearings. Okay. There's a thing in martial arts that the body will go where the head goes, and your head goes where your eyes go. So really, wherever you're looking, in all honesty, is where you're going to go. So all we want to do is, figuratively, is lift your gaze up just a little bit. Don't be looking down thinking that everything's horrible. We got to change that mindset. We got to change those attitudes and those thoughts, that behavior. One way to do this would be focus on the reasons you went into the healthcare profession. Why are you doing this? It probably is because you get a lot of enjoyment and a lot of satisfaction from treating and helping others. So lifting your gaze is going to help keep you from crashing into the ground and being a fatality of burnout. So, when we discover that we're burned out, we're going to pull back our throttle, get our wings level, and then slowly lift our gaze. Once we get stable, then we can work on getting back to where we were before. So I'm going to talk about some practical steps to recovery of burnout. Now, these are just some things you can do to adjust your unusual attitude of burnout. that you or a colleague might be facing. So step one is remind yourself of your real purpose every day. Keep a reminder of not only, your business or your practice's mission and purpose, but what your personal mission and purpose is. And your mission and purpose is what it is you do and why you do it for the benefit of others. Sometimes, if you just review that every day, that can be a dramatic way to recenter yourself and get you on the path to recovery. The important thing is that, remember that the benefit that you have on others, for your staff, for your patients, for your colleagues, and just realize that don't buy into the thought that if you put your heart into your work, you should get something back from it. I think a lot of people kind of see that and they kind of lose sight as to why some of them went into healthcare, because it's to help others, yet putting all this work in and I'm not quite getting it out. It becomes a transactional thing. And just, I would encourage you to consider it a sunk cost. If you put your heart into your work and you're not getting anything back, just consider it a sunk cost. It's gone. You're never going to get it back. But if you recognize that, it'll go a long way for helping in that first step of recovery. The second one is to ask yourself lots of questions. Don't be afraid to challenge the status quo. In fact, the status quo might be contributing to your burnout, faulty processes, too much paperwork, whatever it is. Ask questions, really dig into that. And don't be afraid to ask those questions. I mean, do you really need to attend all these meetings? Do we really need to do all this? Does this paperwork really need to be completed 3 times? Or is there somebody else that could do it? Who could help offload some of this work I have to do? Is there another way we could do it? And so what you want to do is in this step is, do what you can to get your wings level so you can take off, unburden yourself, if you will. Now, the third one is don't equate your work and work environment to your personal value. All right. You are more than what you do 8 to 5 or however long you work. And sometimes toxic environments exist in healthcare. And it's sad to say, but quite true. So what you need to do is you need to realize that your worth as a person doesn't equate to what you do and where you do it. You're more than that. And if you buy into that and you're working in a toxic environment, then you buy into the fact that you're a toxic or bad person. And that's not the case. It's the environment. So you want to buy into the fact and believe that you are worth more than what it is you do or where you work. And balanced thinking is what we're talking about. And it's, not, practice of non-judgment and not judging yourself or others. We all are great some days, and other days, they don't go as well. I mean, that's just part of being human. No one ever does everything perfect 100% of the time. But as long as we're doing our best effort and we recognize that, and we don't beat ourselves up too bad when we make a mistake, that is a surefire way to avoid burnout. So the fourth step is don't sacrifice home life for work life. If you find yourself losing touch with children, siblings, spouses, parents, friends, it's best to call a timeout at work, step back, slow down, pull that throttle back and redirect some energy and time towards those relationships. Okay, because this is what I've seen this in older physicians who retire and they didn't quite get this. But you got to remember, when you retire, those are the people you're going to be spending time with, not the people at the hospital, not the people at the clinic. As soon as you retire, another replacement's coming in, their preference cards, yours are thrown out, theirs are thrown in, and that's it. And they're moving on. All right. The organization's like, hey, great, thanks for having you. Bye-bye now. It's really your family and your friends, that are going to be there when you retire. So focus on those things. And those things not only will be there for you when you retire, but they're going to be there as a support network while you're going through some of the stresses we go through in healthcare. Step 5 is control what you can, but recognize what you can't control. And try not to worry about what you can't control. Just say, I can do this, I can't control that, and I'm going to only focus on doing what I can control and do my best at that. letting go of those things you can't control, it's going to help relieve a lot of that stress and those negative feelings you feel. And remember, those negative feelings are going to insidiously contribute to your feelings of burnout. The sixth step is, get a support group or a mentor to help you go work through your feelings and emotions. Sometimes it's hard to talk with family and friends or even colleagues about our burnout. So find somebody that you can confide with, that they're going to have your best interest at heart, and they'll keep your confidence, okay, and they'll give you what would be good solid advice as you try and work through this burnout. And sometimes it might be somebody in a completely different field. Maybe it's somebody, you have a friend who's in manufacturing and not in healthcare. They may give you different perspective and insight. So don't when you're looking for networking in terms of that or help, don't just stay with just healthcare providers. The seventh one is keep and schedule time for you. Okay. Whether that time is by yourself or loved ones, actually block that time out. If you do that regularly, it's gonna really help you work at pulling that throttle back and slowing down, and recharge your batteries, if you will. And really, I think this is a must. You really got to slow down. And to do that, keep time for you. And whether that's your alone time or with friends or family, make certain that you actually plan that out a week in advance. And then at the end of the week, look back and say, how much time did I schedule and keep for myself? Or did I give it all to the organization? I mean, that's real important for you. The eighth step, don't be afraid to hit the eject button, okay? Sometimes a transition is needed, and it's actually curative of your burnout. Sometimes you just gotta separate yourself from whatever culture or environment you're feeling this in, and that change in and of itself can be enough to help you recover and get out of burnout. If you can't change the culture, or if you can't change yourself, perhaps it might be the best move to make would be to move on and go on to another organization. Or do something else. So I see a lot of folks, they kind of feel like I just can't quite hit that eject button. Well, if you're careening into the ground and you've got to shoot, you might as well hit eject and do what you can to save yourself. And if that means leaving an organization that you thought you always wanted to work at, but now it's not quite what it used to be or what you thought it would be, it's okay. Pick up and move on. Your mental health is far more important than the organization, okay? And then step 9, pick a podcast to listen to, read a blog to help you with some of these things, pick up a book, stimulate your mind, and do things that energize and recharge you, and give you pointers and practical advice. Network with folks, get a mentor or something, and really look for ways to enrich your mind, enrich your soul and your heart. Some qualities that promote resilience. If you have a good sense of humor and you can laugh at things and yourself, that's always a great way to help ward off burnout. If you have the ability to accept the circumstances, then they can't be changed. And if you have the ability to really have realistic goals and you move towards them on a daily basis. And I think finally, really having meaningful connections with others. If you have those, a sense of humor, and what you can and can't control, I think that goes a long way towards fighting and preventing burnout and despair. So in summary, these are just a few things you can do to fight out burnout. Remember, reduce your stress, get your wings level, pull that throttle back and look up. That's how we recover. And perhaps the most important thing is to find someone you can confide in and get support. Once you recognize you're feeling burned out, you're feeling a little bit of despair, find that person that you can confide in, or that organization or whoever it is, and help you adjust your unusual attitude, get wings level, and then work on soaring again. if you go to my website, davidnorrismdmba.com/Sanibel, I got a couple articles there. And then probably later today, I'll put the copy of these slides decks on there for you that you can download. If you want, copies of the questions for the symptoms or the stages, that you can either, use for yourself, use for your organization, and God forbid, use for a colleague. So with that, I will open it up to questions or discussion.
Well, thank you, Dr. Norris. I have missed working with you.
Oh, thank you, Susan. That's very kind.
Very good. Very good. Hey, I just wanted to have some questions here for you, or a comment too. I heard one of our other colleagues within anesthesia also would say, I wish I would have, that you'll never hear him say, I wish I would have worked more. So, before, more longer hours and stuff. And you brought up, make sure that you pay attention and stay close to your family and that sort of thing. I think I appreciate that. I think that's very important. And I've had to, I know, kind of take things off of my table too and say, hey, just can't do that. Because, we're so used to saying, sure, I'll do it. I'll help you out. But then, you get too many things on your table and you just need to learn to say no. But I'm glad you brought that up and all. A lot of different comments and stuff on the chat box. And also, wanted to see, one of them asked, how can we identify these signs and symptoms in our colleagues before they choose to leave the organization? If they're not somebody that wants to share their thoughts or visions, how can you focus on that?
I mean, I think if you were there when they came on board, or you've known them for a while, you can see a change in their behavior, a change in their attitude, the change in the way they act. If you begin to see that change, say they become a little more irritable, they're becoming a little more grumpy, they become a little more rigid or inflexible. No, that's not the way I'm going to do it. I don't care what they say. Those are signs and symptoms that could be leading towards burnout. And if you like them and they're skilled, and you want to try and keep them within the organization, then I would recommend running through those questions. And if you hit some positives, or you get some yeses to those questions, then with the symptom checker, then pick somebody that is level-headed in the group and in a non-accusatory fashion. Just say, hey, we've noticed there have been some complaints, or it seems like you're not quite as happy as you were. It seems like something's bothering you. Don't say you're behaving badly or you're getting more irritable or something. You don't want to make it accusatory. You just want to say, it seems like something's going on. I mean, you want to talk about it. Is there anything we can do to help? And just try and broach that subject. And then you can, if you know them well enough and you're good friends enough with them, just say, look, we're concerned that, are you feeling burned out? Are you feeling depressed? Are you not loving your energy or your job anymore? And what can we do to try and help you revitalize that? Because when you showed up, you were all gung ho, and you're doing a great job. So, I mean, that would be something you would want to do in a skillful, non-threatening manner, but you'll usually see those changes. The only time you wouldn't is if they were really happy and go when you hired them, and then the day one they're miserable. That's just a bad hire.
And a lot of times in today's world, I know my wife is a cardiac ICU nurse, and she's been having to work a lot more hours, a lot more stressful times, working with COVID patients every day. They don't have that, and same with everybody in the healthcare industry. Right now, you can't really step back like you're saying. I mean, how do you, it's a very stressful time. You can't say, well, and you can see it on a lot of people's attitudes where they need to step back, but they don't have the opportunity to step back. That things are going south, but there's no way to avoid it. They can't walk away from that job. They can't walk away from that patient. A lot of people don't have that opportunity.
Well, then what it would come down to, that would be what can we do to offload the stress? Are there other duties, other functions that we can kind of shove out, or are there other people we can bring in to help manage that, some of their duties, or there's things we can hand off? But that comes, if you're a big organization, that comes from leadership. And if you don't have good leadership, sometimes you hit the eject button.
Yeah, but I mean, in a lot of situations, they're taking care of a much heavier caseload or patient load than they were before, because a lot of the nurses that are more or less like you said, they're walking away, they're going traveling, and now they're left alone. They're getting, so it's really a tough situation. I can see it. I can see it on her face when she comes home at night sometimes.
Yeah, I think there's as has been pointed out in our chat session, there's that added problem with being in lockdowns, or no places to go when you do have time off, or no friends to see face to face, person to person, in many of the situations in the world, not just this country, obviously. So there's a lot of things. There's a lot of hurdles there, man.
Yeah. And I think, and some of it also happen to be your personality style. If you're very task oriented and you're not very outgoing, the COVID lockdowns probably aren't that hard on you from a social aspect, because you don't recharge your batteries from that. My daughter and my son are two different personality styles. My son's very reserved and very task oriented, and COVID hadn't, the lockdowns and not going to school didn't bother him. He's like, yay. Whereas my daughter was like, oh, this sucks. I don't get to see friends, and they both handled it differently. And I think that's in large part due to their personality type. And I think there are some personality styles that might be a little more predisposed to having burnout and depression as a result of that. But it is hard. And I think one of the fastest ways to cure it is, open things up as soon as we can. And get that. We're social creatures, let's face it. We don't do well by ourselves, and we need that. So organizations should be doing what they can to encourage that social interaction, but at the same time keeping things safe. It's a challenging time, I will say that.
We have a comment or a question from one of our younger members here, and from Lorraine Flores. She says, how are perfusionists or somebody in the medical field with families able to balance work and life? As someone hoping to start a family in the future, I find it hard to even imagine having time to spend with family and friends with our busy work schedule. I guess it's not really a question, it's just a comment, maybe how you've done it,
How, me personally, how I've done it?
Yeah.
I 2 years ago, I made a transition. I left my very busy practice and I slowed down. I went to a smaller practice. I just made that decision. You got to do, for me, I just did that balance of, all right, my kids are now hitting high school. They're only in my home 4 more years, hopefully. They leave when they turn 18. That's the goal. But I really want to be there for them when they're going through those high school challenges. So I made the decision to hit the eject button, if you will, offloaded some things, pulled the throttle back. So while they're home for those years of high school, I can be there for them. And then honestly, once they leave the nest and they're in college, I plan on ramping back up a bit. But that was the decision process and the values that I used to make that decision. I realized won't make as much, but I don't care. It's more important that, I form a solid foundation, because these are the people that are going to take care of me when I retire, not all my old colleagues.
Mm-hmm.
So, It is hard. It is hard. I'm not going to deny that, but it just takes a little bit of soul searching, and really, I don't regret it. Let's just put it that way. I don't regret that decision, but I valued that time with my wife and kids, and I really want to pour into that. And I think it's paying dividends. I would like to.
Absolutely. Okay. Is there any other questions or comments or anything from our panel or from our YouTube's chat?
No.
Thank you very much.